The rescue mission is a beacon of hope in the city of Trenton.
Without facilities like this, we are talking about a significant segment of our population that just would have no care. We would see an ugliness in this country and on the streets of this country that we couldn't fathom.
It's about a human connection with someone who has no idea how they're going to survive the next day. It's a pretty big responsibility. Unfortunately, our, quote, essential workers have risen to that challenge every day, and over COVID, did more than we could possibly imagine any human being could do for people who were suffering.
The priority to me is providing continual quality services every day. In spite of COVID-19, we have staff that are committed. They did not miss a beat as for reporting the work. Services were not interrupted at any time.
The coronavirus was not going to just go away. That this was something that we had to begin to prepare for. I don't think anyone ever imagined the magnitude that it would get to today. But we had to start to prepare because we had so many lives that depended upon us. So Mary Gay, myself, and Dr. Williams, who is our medical director, really started to brainstorm and think, what are the best practices that we can start to implement and or plan for?
So immediately we thought about universal precautions on site in terms of mask wearing and temperature checks, washing hands.
And we put in place immediately COVID screenings.
Within a matter of days, we had arranged for testing of all the staff and all the residents, which we know now the big danger of COVID-19 is the asymptomatic carrier and how to identify those. The CDC, NIH always said that we need to test broadly and test completely. No other facility was able to achieve that except here. Mary Gay and Barrett tapped all their resources. Dr. Evans at Henry J. Austin was at the table, and we literally implored county officials, city officials to provide us with the resources to test broadly. Because of that, we never had the outbreak at our facility that we thought we would have. Folks who were positive and symptomatic got treatment immediately. We set up a quarantine in an area of the building that had otherwise just been residential space. In a matter of days, we had a quarantine, negative pressure room set up for folks to be quarantined while we tested them. We tested every staff member, every resident, and we kept our rates decidedly low. We had containment, we had treatment, and we had stability in a matter of days.
March 13th, 2020 this year, the rescue mission made the decision that we were going to, in essence, lock down our facility 7 or 8 days before state-issued guidelines. We have 300 some people that we care for. We had to try to do what was right at that moment to keep them all safe.
The employees here were amazing. They were afraid. They were afraid, they were scared, they were worried about the safety of their family, but they showed up every day, right? And we gave massive in-service to educate them on skill sets that weren't part of their wheelhouse, on wearing PPE and on sanitizing. And they came with without them, this would not have been possible. Folks would never believe at a shelter for the homeless you can use PPE and hand sanitizing and social distancing and get the residents to comply, and they did.
I think that, for the staff that are working inside the mission, it is very clear that the individuals that are coming in for services are our brothers, our sisters, our parents, our grandchildren. I absolutely believe that the entire community is served by the work that we do.
I just had a light fever, so they took me to the hospital, then I stayed there overnight, and the next day I had to end up staying in the motel for a while. I stayed there for like 14 days. And I know a lot of people, they still dying from it. Yeah, I was lucky.
Oftentimes when we talk about human civilization, we talk about how far a civilization achieves. there's another measure of how civilized or how advanced the civilization is. That is, how far they are willing to let the least of their denizens fall. And places like this are that net that prevent folks from falling to bottom.
How horrible their life circumstances is when they literally don't know where they can go to the bathroom or sleep that night, and someone says, come in. That isn't the rescue mission, that isn't the Mary Gay, that isn't the board that says come in. It's the lowest paid person at the rescue mission, those essential workers we're all celebrating today, who opens the door to a complete stranger and says, come in.
I am proud and awed by the amount of work done here at the mission and in preparation to deal with the COVID pandemic. Of all the places I work, and I work in several different venues, the rescue mission, surprisingly, was at the forefront of getting ahead of the pandemic and in doing what the medical science told us we needed to do. That is what we need to move towards in order to contain this. And I'm saying that from the standpoint of we see it in action. It worked, and it's working.